Viewers, good morning. I am Dr. Jayant, plastic and cosmetic surgeon. Today we are going to do hair transplant for this patient. He is 28-year male patient. He has a family history of baldness. His maternal uncles have baldness history, but his father and uncles, they are having normal hair. So we can see this patient is also start losing these hairs for last 5 years, and we can see diffuse thinning in this frontal area, middle area and buttocks area. There are few hairs, but these hairs are very thin, and we can see the frontal area, the frontal zone are already emptied. So it gives a tired look and it gives a aged look. So our patient, our friend come here for hair transplant. Today we will be doing this hair transplant under FUE technique, extraction technique. There will be no stitches. We will be harvesting these follicles from beard area and also from the back. Around 3000 follicle we have planned today to transplant. So let us do the marking first, then we will do the surgery also. So today we have planned for transplant of 3500 grafts, and the most important point to mark the anterior most of the hairline. We know this anterior hairline, this recedes gradually with our age. So best way to demarcate the anterior hairline is just to ask the patient to see above. So where this corrugation ends, there the forehead ends and the scalp starts, and we can see also there are few hair follicles still present. So we will be marking from here. This is the one of the best way. Another way is making forefinger from the nasion. This is the nasion above forefinger. Above forefinger is little bit higher for him because he is 80 years of age, but we can see the corrugations from here. So we will be starting from the corrugation. Laterally the corrugation may not be much prominent. So this is a rough estimate. We will make it symmetrical. So we have done the marking. This is zone 1 where most graft will be used. We will be using around 1400 grafts in zone 1 because this thing comes in photo. Then the zone 2, this is the central tough area. This is the second most important zone. This zone 3 is least important zone. Our next important zone is zone 4, because when photos are taken from the back we can see this zone 4. So zone 4, zone 1 and zone 2, this is the photographic zone. Zone 3 is on the top of the head, so it does not come on the photo. So this is our plan, and our friend is having long hairs to cover this. So we can see the position of the hair can actually determine how you looks. So when we take these temporal hairs over the scalp, we can see he is having a good coverage. But if we comb it straight, then we can see that there is diffuse thinning of the hair, and also in zone 1 there is definitely baldness in zone 1 and zone 2. So this is how we do marking. There are the 4 zones 1, 2, 3 and 4. Because our friend is having few hairs over his hair, that is why we can cover this 4 in one go, and also we are using 500 grafts more. So this in zone 1 we will be using around 1400. Rest of the hairs will be distributed in zone 2, 3, 4A and 4B, and this surgery will be done by FUE technique where we will be extracting the hairs and also from the beard, and we will be using it.